Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Hi, welcome to the Taylor Method for Pain-Free Living. This is Dr. Derek Taylor. I'm here with my guest, Dr. Felicitas Madziwa, who is a doctor of internal medicine. Dr. Madziwa, welcome to the show.
Thank you. Thank you for having me.
Yes. So now you practice internal medicine. You practice at, are you at the hospital there in Jupiter?
No, I'm at the hospital in Palms West Hospital and JFK Hospital.
Okay, great. So you're taking care of the patients in the hospital, but you had your own integrative medicine practice in North Dakota before, correct?
That's correct.
You just recently relocated here to Palm Beach Gardens, Jupiter area, and you're working currently in the hospital, and you do concierge medicine, correct?
That's correct.
So tell us a little bit about your practice. You have an interesting practice. You have a blend of Western medicine and alternative. So tell us about that. How did you get involved with that?
Well, I got involved in integrative medicine in 2008. That's when I started my fellowship. Prior to that, in 2007, I had a patient that came to me. It was a new patient, and she wanted me to refill all her medications, and she had like 20 pills that she needed, different types of pills that she needed prescribed. And I looked at her and I'm like, how is she even able to function with all these pills? Some of the pills were for taking care of the side effects of the other pills. She needed a lot of pain medications. She couldn't sleep at night, so she needed sleep medications. And then during the day, she needed medications to keep her awake. And I was like, I am originally from Zimbabwe. And we do not have the luxury of having so many medications. And most of the times we really look at, what's in our diet, how our environment, how are we, are we happy? And when those fundamental things are addressed, in most cases, you need a few pills, not 20 prescription pills. So for me, when that happened, I say to myself, with the basic knowledge that I have from being Zimbabwean, I wanted to see, is there a way of actually practicing medicine, integrating it, where you are not throwing away the goodness of pharmaceutical therapy, because it's important, but you also have to look at how can you help patients without needing so many pills. So that's how I stumbled upon integrative medicine. I did a 2-year fellowship at University of Arizona under Dr. Andrew Weil. And then when I was done with that, I joined A4M and I became a member, and I did all the courses that they had at that time that helped me to have a basic knowledge of functional medicine, anti-aging medicine, and regenerative medicine. And with all that armamentarium, where I was able to now take care of hormones, hormone therapy, gut issues, looking at the root cause of illnesses, I was able to open my practice in North Dakota, and it was called Total Transformation Clinic.
Wow, that's exciting. And how long did you have that clinic for?
I ran that clinic for about 4 years before I relocated to here.
And what were some of the common conditions that you saw at that clinic, as well as the common conditions that you're seeing now at the hospital? I'd imagine you're seeing the same conditions, correct, to a certain degree?
Yeah, correctly.
Two different approaches, but you're seeing the same condition, the same patients coming to see you. So
absolutely.
Tell us about that. How you, well, let's go back to, let's talk about what you're doing now. Tell us, when somebody comes to see you in the hospital, what are some of the most common conditions that you are commonly treating as an internal medicine?
Yeah. In the hospital, patients are coming in when they have severe symptoms that need to be managed urgently.
Yeah.
And in most cases, patients are coming in with sepsis, mostly because they are diabetic, and they, some of them have like a diabetic wound that they have not, taken care of, and then, they end up coming into the hospital with severe infection.
Right.
And, in most cases, the management is, to chop off a leg and stuff like that in order to save the life. So in the hospital, you are really dealing with the end spectrum of managing
Right.
a disease, and you're really dealing with critical patients. But people that have high blood pressure, they come into the hospital when their blood pressure goes way too high, and they end up with severe headaches, and they come in with stroke symptoms. And they, so we have to manage those patients that have had strokes. They come in with heart conditions where they have a heart attack. They come in with a chest pain, and we diagnose that they now need to have a quadruple bypass, and we send them to the surgeons to get that done. So we are really, when I compare what I see in the hospital and what I see in integrative medicine, a setting or in the office setting, you are seeing, patients that have had a disease like type 2 diabetes, and it ends up, because it's not well managed, you end up with severe symptoms. And in integrative medicine, what we are trying to do is to reorient patients from looking at diabetes and owning it and saying my diabetes, looking at it as this is something that if it's type 2 diabetes, this is something that if managed well, you take care of your diet, you take care of what your body really needs, you take care of stress management, very important. When you do the right things for the body has the capacity of healing itself. And giving them supplements, and looking at gut health, what can we do to promote optimal health? That's what we do in integrative medicine and functional medicine.
Wow. So I mean, what's beautiful about the skills and the knowledge and the experience that you have is that you know how to handle the end spectrum of crisis care and urgent care. In those cases, you need good medical intervention, right? If somebody has a diabetic wound and it's sepsis is there, they may require amputation there to saved their life, right? Or if they have high blood pressure and they might need some type of surgery to overcome their quadruple bypass. So you know how to handle those, and you can recognize those being trained as a medical doctor. But then on the other hand, you also are focusing on prevention and integrative medicine, which a lot of your colleagues have had no training or any desire really to focus on the preventative aspect. And so I love the beautiful blend that you possess of both preventative and being able to handle the crisis care. So it sounds like you work with a lot of diabetes and high blood pressure, hypertension, heart conditions, diabetes. You probably occasionally come into contact with cancer patients, right? That you may discover. In fact, your husband is an oncologist. He works with a group of oncologists is that in West Palm Beach?
In Loxahatchee, yes.
In Loxahatchee. So, I mean, you're right in the thick. You have all this knowledge with medicine, but at the same time, you saw that one patient that was on 20 different prescriptions, and you said, "Wait a minute here." That was like an eye opener for you. You said, "Wait a minute.
Absolutely.
How can I love your heart to say, hey, how can we prevent from somebody even getting to this place?" So you went and opened up your own integrative practice in North Dakota for 4 years. I understand it was a very successful practice. Tell us a little about the things that you did in that integrative practice.
So the most important thing that we do as integrative medicine physicians is when a patient walks in, it's, when they walk in, you already know, how, you already diagnose from just seeing a patient, how how regulated they are or dysregulated they are in their patient care. So in most cases, like for me, I'm somebody who really likes to go deeper into spirituality and as a form of knowing how to do stress management. So most of the times I would teach my patients to, just for the first 5 minutes, let's get to focus on something that most people do not focus on, and it's so important, and that's your breath. When we take the time to just breathe, it's the most important stress management, stress busting, lowering of cortisol that you can ever do to yourself. So helping my patients to understand that there are tools like breathworks that can, manage, like if somebody is having a panic attack or an anxiety attack, you can manage that with your breath, and teaching you that, really it gives me so much joy knowing that, if you go to to just an internal medicine doctor, they are going to say, okay, how many pills do you need? You walk out with 5 prescriptions. When you come to me, you walk out with supplements to help with your gut health. You walk out with, an understanding of how your body really works, how your mind works, how everything that we do is, if we don't take care of the stress part of the equation, in most cases, people are getting sicker and sicker and sicker, mostly because we are not actually in tune with our mind, body, and spirit. So I really love, connecting the dots and making sure that we are taking care of the whole patient instead of just the symptom that you come in with.
You mentioned a few times on gut health. Talk about that. What type of diagnostic test do you run for gut health, and what are some of the remedies or supplements that you like to focus on in regards to your gut health? The gut is so important. Can you talk about that for a little bit?
We do like a stool a stool test. We give you a kit where you actually, we look at what your stool is telling us. In most cases, it's going to tell us that you have the good bacteria is depleted, and you have so much of the bad, and that is really causing, it's so important when you look at the flora of your gut. When that is disrupted, you are going to, you're not going to be healthy. So we look at that. We look at, there's also tests for us to see if you have enough digestive enzymes. Most people are taking a lot of antacids, and in order for them to not have gastric esophageal reflux. But in most cases, it's just needing you need your digestive enzymes to be balanced. You need your flora to be balanced, and you also need to have enough fiber in your diet, because without the good fiber, you need soluble and insoluble fiber. You need both types. Without having that, you are not actually feeding the bacteria properly. So in most cases, we end up giving you not just probiotics. We also give you prebiotics, which are mostly the good soluble fiber that the gut needs in order for the flora to flourish.
Right. Now, a lot of patients, they get on, they take a course of antibiotics. Let's say they have a dental procedure, they're getting in on antibiotics, so they have some type of illness. They'll go to the medical doctor, they'll get some antibiotics. Tell us about that we know that wipes out the gut flora, correct?
Yes.
If you don't take, if you're not in your diet taking an intake of foods that are going to be replenishing that, or taking acidophilus, or does that gut flora ever get balanced on its own? How long does that, in your clinical experience, what kind of impact does that have on the person's gut health when they get on a round of antibiotics?
It's very disruptive, and you find that like, for example, if somebody has a urinary tract infection, they get antibiotics, and they get better in terms of the urinary tract infection, but they have really depleted their good bacteria. They end up with constipation, feeling bloated all the time, and for some people, they might not even have those kind of symptoms, but they end up with another urinary tract infection. So, and then they take more antibiotics and deplete even more.
And it's a cycle. It's just
a very, very bad cycle. And so in most cases, what I usually say to my patients is, if antibiotics are important. If you need them, you need to take them. However, you also need to be smart about what are you doing to replenish the gut flora that you are disrupting with all these antibiotics. And so then, we have like a plan where we give you the probiotics and the prebiotics you need in order for you to replenish what you lost.
Now, when you do some of these stool testing, are you also looking for microbes that may be causing damage to a person's health, parasites, candida?
Oh, absolutely.
And
yes,
so how do you address that? Do you use conventional medicine to handle something like a parasite, or do you use alternative natural supplements, or it kind of depends, I guess, maybe on what you find?
Yeah.
Maybe do you have a combination? I mean, tell us about that.
Yeah, it depends on what you find. But, sometimes, the best way to kill parasites is to use conventional medicine. And then, you take care of, replenishing the gut with supplements. But you do need, so, for me, that's why I think being an internal medicine physician, who also is, has all the knowledge, regarding holistic therapies, it's so much easier for me to guide patients.
Yes.
So that we are not only, looking at one thing, and we are not, in it, you have to understand that there's, pharmaceutical medications, those things are important, but at the same time, if that's all you have, that's, pharmaceutical medications, and that's all you have in your toolbox, you're not doing the best for your patients.
Right. Absolutely.
That's how I see it.
Yes. Now, what are some of the common medications you use for parasites that you've had success with?
Mebendazole is one of them that I have used.
Mm-hmm.
And
so will you see the symptomatology improve quite a bit?
Oh yeah, yeah. If the thing is with holistic therapy and with any medical treatment, that the patient has to understand that they're the ones that are that will determine whether they will get well or not. So if a patient is prescribed supplements and everything, and they don't do the protocol, they don't take the supplements, then they are not going to get better. So
Right.
If you have a patient that is, really that wants to get well, and I find it's very easy if somebody comes to my practice, it's somebody that really wants to be well. So in most cases, people that are really focused on their wellness, they will do whatever the protocol that we prescribe, and they get better. I had cases where patients had suffered from migraine headaches for a long time, and they really didn't have anything to that helped them. But all we needed to do was do a food sensitivity test here, take care of the gut, take care of the stress, and you find that if you do a complete protocol on a patient, you end up helping that patient to heal. Most of my patients were very, very grateful when I was practicing both doing internal medicine and integrative medicine.
That's the power of your degree and your expertise. You can say, hey, you have a bad case of this, but in this case, I think it would be a good idea to use conventional medicine and then take care of that issue. And then let's go ahead and strengthen it with integrative natural supplementation afterwards, or vice versa, or whatever. You have that freedom to use both. And I think that's pretty powerful. Now, along with gut issues, there's also, being in North Dakota, I would imagine that you may have seen a few Lyme's patients there, people with Lyme.
Oh yeah, yes.
And so did you have much success with helping people with Lyme's disease?
Lyme's disease is really, it's a very, very challenging, because it like people have severe chronic fatigue because of it. And for some, we actually would say it's important to use the conventional therapy for Lyme, but then do the other things that will help, get your body to feel better. And make sure that we do IV vitamin therapies, and especially the magnesium pushes, very, very important in patients that have Lyme disease. So
it's challenging. Anybody that says that they're going to be able to take care of that really simply, that's not the case.
That person is lying to you. It's a very challenging disease.
What were some of the most favorite conditions that you like to treat in your office that you saw great success with using integrative medicine?
I would probably say patients that had fibromyalgia, patients that had chronic migraine headaches, patients that had like the beginnings of ulcerative colitis and Crohn's disease, that has not, that is not to the point where they need immunotherapy. When you catch it early and, you really take care of the gut properly, that used to be one of the thing that I would be so happy with when a patient no longer has, the diarrhea, they are pooping normally. It's amazing how, when you take care of, what you eat, things that cause inflammation to the gut, it's a lot of things. So if you know what is inflaming your gut and you take care of it, you stop those things, and then you give your gut what it needs for it to to replenish itself. You'll find that if it's early, if you catch it early, you can actually help a patient from having a colectomy later on, which I see in the hospital a lot, where we end up having to remove the whole colon, mostly because wow. The inflammation is so severe.
Tell us about one of your most memorable cases that you remembered that you just really had an impact on that patient using your preventative measures in your total transformation clinic there. Tell us about something that you caught early enough and you saw, man, if this person had used a regular conventional route, they would have ended up in a bad case scenario, but through your natural means, you really made a difference. Can you think of an example or two of a patient?
Yeah, yes, I can think of, I had one patient that had a severe case of autoimmune disease. They had rheumatoid arthritis that was just diagnosed, and their rheumatoid factor was sky high. Their ANA was elevated. They had so many issues with their immune system, and they when they saw the rheumatologist wanted them to go on so many of these medications and shots and weekly injections and all that. And this patient didn't really believe in being on so many medications. So she came to me. She was actually somebody that I ended up helping, mostly because I felt like she didn't have the resources. She didn't have the money to pay for what I did in my practice, but I ended up helping her. And she was such a good patient. She did everything. And, she took all the supplements that we recommended. If we say, don't eat this, because, your food sensitivity is saying this, she didn't eat that. And she wrote me a letter that, literally made me cry, that, if only more doctors could, look at a patient and not just think about what's the next pill, what's the next pharmaceutical pill that I can give, but look at a patient as a whole and figure out how to take care of what is really causing that immune system to go this way. So finding the root causes of diseases and taking care of them. For that patient, she was absolutely, we healed her. When she went back to the room, I asked her to go back to the rheumatologist just for, for them to run the test, and, her rheumatoid factor had gone down, and, she was a completely different person from the person that was so debilitated. She hardly could get out of bed. She was in pain, chronic pain all the time because of the severe inflammation in her body, and we took care of it.
Wow, that's powerful. Yeah. I mean, that's how rewarding is that? And the body's got an amazing ability to just, you take some of the stressors out and some of the toxins and some of the offending areas, and it's got an amazing ability to heal itself, doesn't it?
Absolutely. Yeah.
Yeah. Yep. And so, wow. and I was talking to you earlier today, and you were mentioning how some of your patients at the hospital, they tell me what you told me earlier when we were having our conversation. What are they saying to you?
Most of the times, so if I'm talking to you, I am completely present, and I am one of those physicians that will do, a thorough examination. I will talk to you until, all your questions are answered, and I take my time with all my patients, because that's the most rewarding part of being a physician, when you can interact with another human being and help them to be at ease, because the hospital environment is very stressful on its own. So most of the times I end up, patients ask me, how can we make you our doctor? There is no way I would want to go back to my other physician.
Well, yeah, I mean, and that's what happens. I've gotten to know you over the past couple of weeks, and you're a very caring person, and just, I can just sense that right from the get-go at you. And I can't imagine the doctor-patient relationship you have with a lot of your patients, and they just sense how much you care. And that's so important, because sometimes it's easy as a physician just to get caught up in the, hey, this is what I do. Patients becomes another number, and, or another condition, instead of looking at the human quality of the person, that these are souls, these are people that, have feelings and are going through issues in their lives, and they need to look beyond just the physical and just look at it. These are people that need to be loved and cared for, and I sense that from you with your patients, and it's a beautiful thing. And so maybe there's probably some of our listeners here that said, wow, I would love to be able to have this type of care where I'm getting both integrative and conventional needed. You have a concierge practice, and people can work with you via telemedicine, correct?
That's
correct. And I know you're in hot demand. Your practice is very busy. It's hard to get a hold of you, but how could our listeners get a hold of you if they're interested in learning more about your services and having this type of one-on-one, individualized caring care here that is going to be a blend of conventional as well as alternative? How can they get a hold of you? What's the best way?
The best way is to shoot me an email.
Okay.
And my business is called Brain Health Longevity Clinic, because I have to explain it. I am so in love with knowing that when we take care of the brain, and we do the right things in order for us to think properly, in order for us not to do the bad things that end up causing our health to be in jeopardy. So my clinic's name is made in it reflects what I really want to accomplish in everybody that I take care of, to have a beautiful brain, to be healthy, and to live long, happier. So it's called, if you are going to email me on brainhealthlongevity@gmail.com. So the three words, brainhealthlongevity@gmail.com.
Yes, and you are in the process of completing your book, correct, here soon, sometime in the future.
Very exciting.
Well, I can see why you do a lot with the gut, because the gut is so connected well to the brain. A lot of the same cells are in the gut that are in the brain. And if you have a bad gut, it's going to affect your ability for your brain to process and to function well, correct?
Yeah,
it's amazing how God put all that together and integrated the brain with gut health and vice versa.
And also with the heart. So there is, like there's an organization called HeartMath that really looked at how the heart, when you breathe in such a way that your heart is happy, it actually ends up causing different neurotransmitters to be secreted in the brain. So that's one of the things that I teach my my patients, so that they can have a good heart rate variability, which is a signal of your autonomic nervous system being being healthy.
Right. Yeah. I mean, just the takeaway here is just people just need to slow down and breathe, right?
Absolutely.
Just slow down, take some deep breaths. I mean, that alone, just doing that can help lower some of the tension, having that balance and getting some exercise, going outside, just that balance. And I think that's so important. Well, it's been a pleasure talking with you on this show, Doc. And I look forward to seeing your book here in the future. And our listeners are probably looking forward to maybe getting to know you and establishing a relationship with you. And it's good to know that there's still doctors out there that really care and also are a blend of both integrative and conventional. So thank you for being on the show today.
Oh, thank you so much for having me.
This has been Dr. Derek Taylor here. We're ending our show here with the Taylor Method for Pain-Free Living. Our guest, Dr. Felicitas, and thank you again for so much of your time and expertise. And we wish you the best of luck, and we all look forward to getting to know you more in the future.
Thank you.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.